Arch bars. Theoretically, the wire is supposed to be inserted around neck of each tooth. The wires should pass interdentally in embrasure around the neck of the tooth. Care needs to be taken not to lacerate the gingiva. But practically, involving each tooth sometimes becomes too much cumbersome, time-consuming, and uncomfortable for the patient and causes more tissue trauma. Therefore, approximately wiring alternate tooth is enough if all teeth are present. In case of presence of edentulous spaces or missing teeth post-trauma or mobile teeth or teeth with compromised periodontal status, more teeth should be involved in wiring. Once the wires are passed interdentally around the embrasures of tooth, we need to orient both ends of the wires. If the mesial end is oriented occlusally, the distal end should be placed apically. The whole motive is that once we place the arch bar, both limbs of the wire should be on the either side of the arch bar. The arch bar is finally placed. The assistant must hold the arch bar in position with his fingers or periosteal elevator when the operator twists the wires. This is done so that the wire tightly clings around the neck of the tooth below the cingulum. Twisting of the wire is done in same fashion as in Riddle's wiring. Arch bars are indicated for temporary fragment stabilization in emergency cases before definitive treatment, as a tension band in combination with internal fixation using many plates, for long-time fixation in conservative treatment for intermaxillary fixation, for fixation of avulsed teeth and dentoalveolar fractures, and conservative management of condylar fractures. Rosettes are made.